I'm here to inform you that even after having chicken pox and or being immunized for them, you can still have an adult onset of chicken pox called the shingles. I'll show how the chicken pox can still be dangerous to older adults even after you've been immunized. Hi, my name is Julie Prestridge, and I found that shingles is a viral lying dormant in our system and as dangerous to many as the chicken pox. After you've had the chicken pox, the virus lies inactive in your nerve system near the spinal cord and brain. Shingles is a viral infection that causes painful rash. This is the same virus that causes chicken pox. It lies dormant in your nerve system, and when your system's weak or you're exposed to the virus again, it reactivates and causes shingles. What causes the breakout? As we get older, our immune systems deteriorate and the virus reactivates. Shingles is more common in older adults or in people who have weak immune systems. Some of the symptoms to watch for: shingles can affect one side of the body, usually the side of the heart. These signs can include pain, burning, numbness, or tingling, which are usually the first signs. A red rash that begins a few days after the pain. A fluid-filled blisters that break open and crust over, which look just like chicken pox. Itching, fever, chills, general aches, headache, fatigue, weakness, and tiredness. Is the shingles contagious? Usually shingles blisters, once they scab over, are no longer contagious, but until then they are, so you want to avoid anybody who has not had the chicken pox, who have weak immune systems, such as newborns, pregnant women. Some of the risk factors involved with shingles are people over the age of 50, and as their age increases, so do their risks. Some of the experts estimate that over 50% of people age 85 will have at least experienced shingles once in their lifetime. Here is a chart. Here's age 50 and here's age 85. See how dramatically it increases on the exposure to shingles. Are there complications to be aware of? Of course. Complications consist of muscle weakness. Shingle pain continues long after the blisters have cleared. Scarring from scratching. Shingles in or around the eyes can cause painful eye infections or deteriorated or even vision loss. Pain from a source that would not normally cause pain, such as a slight breeze or your clothes touching your skin. Some of the neurological problems that can be a result would be encephalitis, which is an inflammation of the brain, hearing or balance problems, facial paralysis, skin infection, even a bacterial skin infection if the blisters are not treated properly. We diagnose shingles based on the history of the pain. Shingles is usually on one side of the body, along with the telltale rash and blisters. The doctor can take tissue samples to examine in a laboratory. Some of the treatments are antiviral drugs, pain drugs such as oxycodone, tricyclic antidepressants, anticonvulsives, numbing agents such as lidocaine. Some of the home remedies would be getting plenty of rest and avoid strenuous exercise. Avoid stress, because that can cause pain to worsen. Practice relaxation techniques. Try doing other exercises such as reading a book or watching a movie to take your mind off the pain. Taking a cool compress or a cool bath on the blisters so that will relieve the itch and pain. Some over-the-counter medications such as Advil, Motrin, or Aleve will help relieve the pain. Anti-itch creams or calamine lotion will help relieve the itch. Oral antihistamines such as Benadryl to help relieve the itching and pain. How can we prevent shingles? Well, there's currently 2 shots. One is the chickenpox virus vaccine that we actually have as the common childhood treatment. The other is a shingles vaccine, and it's not intended to treat people who currently have the disease. It's to ensure, you need to ensure that it doesn't have any kind of life-threatening allergic reaction to the gelatin, the neomycin, or any other component of the vaccine prior to taking it. Shingles is a known virus that you have waiting in your system to strike. Watch for signs, symptoms, and consult a healthcare provider to ensure treatment as early as possible. Chickenpox is not always a childhood illness, since it can strike older people despite the fact that their immune systems should protect them. Thank you.